This is a gallbladder with associated gallstones. Cholelithiasis is the most common cause of biliary tract disease. Risk factors include advanced age, pregnancy, female gender, metabolic syndrome, and obesity. The two major types of stones are cholesterol and pigmented stones. Grossly, cholesterol stones will be pale yellow and round with a granular surface. I do not have a pure cholesterol stone to show you at this time. Pigmented stones are more common in hemolytic anemia disorders. They are brown or black due to bilirubin and calcium salts. Here are some examples of pigmented stones. The remaining stones represent mixed stones, which have features of both. Most gallstones are asymptomatic. However, acute cholecystitis can develop if the stones obstruct the bile outflow by lodging near the neck of the gallbladder or in the cystic duct. As bile builds up, there is increased pressure and distension of the gallbladder, leading to decreased blood flow and mucosal ischemia. In such cases, the gallbladder will be enlarged with a fibrinous exudate on the serosal surface, and the wall will be thickened up to 4 millimeters and hyperemic. That is not the case with this gallbladder, which, as you can see, maintains a thin wall, which is quite flexible and pliable, less than 4 millimeters.